Hi team, I wanted to share another very valuable resource with you that can help you map out your future in health informatics and information management. This career map is housed on the AHIMA.org website, and I'm going to provide this website to you in the email and even on this video. And this is the career map. And as you can see, it's got all of these areas that we learn about in our programs: data quality, consumer health informatics, data analytics, informatics, privacy risk and compliance, and even revenue cycle management. Any of the jobs that are represented by the white circles are current jobs, and then these orange diamonds are emerging jobs and jobs that may be coming as we see innovation, we see changes in technology, emerging technologies in the ever evolving healthcare ecosystem. And as you can see, you'll see that these rings are labeled with entry, mid, advanced, and master. So depending on where you are in your career and where you are after you finish your degree, and then of course what certification, what experience you can have will depend, of course, and determine where you are and where you land on this circle. So let's just look at a couple of these roles. So let's just say that I am entry level and I am coming out of a program, and I just want to really just, even while I'm in the program, I want to get my feet wet. And so I want to go over and work kind of in the data analytics and consumer health informatics realms. Data analytics, of course, is analyzing data, finding trends and things in the healthcare data. And then consumer health informatics deals more with like patient portal and digital health and platforms used to inform the patient and patient experience. So some of the entry level jobs are patient service representative. You can work in administrative functions of a physician practice or other healthcare setting. And what you do is you represent the patient, whether it be in educating them on how to use that consumer health informatics platform or helping them to navigate their time in the healthcare organization. Another one would be, of course, as a student working as a medical records clerk. You can also be a community health worker. And that way, this would help you, actually help the public in accessing and navigating health and social services, providing health education and resources to promote community engagement opportunities. That is really a cross section between health informatics and public health. So that would be a really great job. Then, as you continue with your education and you're in the mid level, you'll see that there's a registrar, a disease registry. Cancer registry right now is a growing field, but there is a shortage. So there are some hospitals that will hire you to come in and work as an apprentice and then pay for you to be able to sit for your exam to become a tumor registrar. Then, if you'll look further, let's just say in this advanced ring where you'll get more toward data quality, you'll see that there's a coding educator if you decide to go into coding and documentation. Then you'll see that there's coding supervisor if you decided to go into the revenue cycle arena. Now, because this is a health informatics program or a health information management program, you may not want to go in that area. And this is not PC or computer coding. This is actual medical coding. There are ways for you to get the skills to become a coding supervisor or do medical coding, but it will require you to do some additional skill set enhancement. In the data analytics, you've got your clinical data management. That is on more of the consumer health informatics and data analytics side. So these are some of the current roles. Well, let's look at some of these emerging roles. HR data integrity specialist. They play a vital role in managing and ensuring the accuracy and integrity of data within the electronic medical record system. That's definitely what we do when we talk about data integrity, data governance, and data usage. Health equity manager. We talk about health equity and how health equity is an important part of creating equitable opportunities and providing care regardless of geographic, socioeconomic, and ethnic barriers. Another role, chief data officer. This is an emerging role. They provide vision and strategy for all data management activities, including healthcare data system life cycles. Then when we get over toward informatics, we see another role, Chief Health Informatics Officer. That is on the master level. On the advanced level, you've got an HIM project analyst. I talked to you all about how there is such a shortage in project management prepared people, that especially people of color, and how your program does give you a project management basics course, but there are also skill set enhancements that can help you prepare for the project management exam. And then you've got your data quality analyst job, decision support. I know that you all will take or have already taken the class with Dr. Elise that talks about clinical decision support. And then clinical informatics specialist, which will be a culmination of everything that you learn here in your program. Let's just say you want to move into privacy, risk, and compliance. You get a lot of that information in the classes that you'll take with Dr. Gabriel. Some of the roles, privacy officer. A privacy officer works with making sure that patient information is safe and making sure that that even if there are vulnerabilities, that patients are protected so that you keep intruders out. So you keep the systems and patient data safe. Compliance manager, to make sure that you are overseeing and managing regulatory compliance within the organization. As we move around the circle, you'll see revenue cycle management. Again, if you want to get into the revenue cycle, one of the first courses that you took with Dr. Colley was about revenue cycle and value-based care. Understanding that is really important to working with the revenue cycle. That's definitely an opportunity. And you can also use your skills that you learn about informatics in your training about for revenue cycle. PPS coordinator provides support in the completion of data contained in the rehab and PAI for patients, in addition to staff education and training. This deals more with the rehab. So there's lots of information and data to be managed for that patient type. You'll learn that with me in your class, in your communication class, when you look at different types of patient care. So there are lots of opportunities. And as you can see on this map, you can click on it and it'll tell you a lot about those jobs, the existing jobs, and then the emerging jobs. So take a moment, check out this website. Send me any questions you may have. I'm so excited and will look forward to answering them. Have a wonderful day. See you soon.